Welcome, everybody. So glad everyone could join us today. Welcome to the APHA, American Public Health Association's Google Hangout on Emergency Preparedness and Response on this Get Ready Day 2015. I'm Lindsay Wahowiak. I am the senior editor at the Nation's Health. I'm with APHA's Communications Department, and we are really excited to host this hangout in celebration of Get Ready Day, in which APHA and public health leaders help Americans prepare themselves and their families for all disasters and hazards, including pandemic flu, infectious disease, natural disasters, and other emergencies. Today's Google Hangout is about extreme weather emergencies caused by climate change. Specifically, we are going to talk about wildfires, flooding, and vector-borne diseases. With me today is a great panel of public health professionals, leaders, and advocates. They are going to share their unique perspectives, experiences, and best practices on preparing for the effect of climate change on our environment. So let's start off by giving everybody 1 minute each to introduce themselves and to share what aspect of preparedness they will focus on. So our first speaker is Matt Cahalan, who is with the New Hampshire Department of Health and Human Services. Matt, you want to tell us a little bit about yourself?
Sure. My background is in public health as a health educator, and I've taken on various roles, working on hazardous material response, working on environmental health surveillance in the state, and more recently working on climate and health. So we're really looking in New Hampshire at what are the severe weather events that are occurring now, how they expected to change under high and low emission climate scenarios, and how can we better respond as public health professionals to deal with this, and especially looking at the vulnerable populations who are affected most by heat waves, flooding, by changes in allergens. So I'll focus on those today, maybe mostly on flooding.
Beautiful. Very excited to talk with you about that. And next up we have Dr. Ben Beard from the CDC National Center for Emerging and Zoonotic Infectious Diseases. Dr. Beard, welcome.
Thank you, Lindsay. It's good to be here today. I work here in CDC's Division of Vector-Borne Diseases. We're in Fort Collins, Colorado, and have two jobs here. One is I'm branch chief in the Bacterial Diseases branch. So we have responsibility at CDC for a group of diseases that are bacterial, transmitted by ticks, mosquitoes, and fleas. So this is Lyme disease, plague, tularemia, tick-borne relapsing fever, and Bartonella. And then my unpaid night job is I'm the Associate Director for Climate Change for our center, the National Center for Emerging and Zoonotic Infectious Diseases. And so in that capacity, I help coordinate CDC's work that focuses on climate and health in the world of infectious diseases. And so that's pretty much what I do here.
Fabulous. A busy guy, for sure. And then last but certainly not least, we have Dr. Linda Rudolph, who is from the Public Health Institute. Dr. Rudolph, welcome aboard.
Hi, I'm delighted to be here today. Thank you. I am the director of the Center for Climate Change and Health at the Public Health Institute, and we work with health professionals and local health departments around the country to increase awareness of the fact that climate change is the greatest health challenge we face this century, but also one of our greatest health opportunities, because if we implement climate solutions, we also improve community health in a whole variety of different ways. Today I'm going to talk about mostly about wildfires, which are, of course, as anyone who has been listening to the news knows, a very present health danger right now as we speak in many parts of California.
Yes, and in fact you have some personal experience with that very recently, which I think we're going to talk about in a little while, right?
Yep.
Okay. Ooh, close calls everywhere. All right. Everybody, we are super excited that all of you could join us today. For our viewers, you too can participate in this Google Hangout. You can post your questions on Twitter using the hashtag APHAGetReady. So we will be watching the feeds for your questions. Feel free to ask loads and loads. The Hangout on air is being recorded. and will be made available on the Get Ready website and APHA's YouTube channel. So if you have to step out for a minute, you will be able to catch it all in its stunning glory later. If you would like to continue the conversation afterward, I know we're getting a little ahead of ourselves, but APHA is hosting Climate Change Health 2 CDC Brace grantees take steps toward adaptation, a webinar tomorrow in partnership with the National Center for Environmental Health at the Centers for Disease Control and Prevention at 1 p.m. Eastern. So if you are watching this live, very lucky for you. If you are watching this later, I'm sure that will be recorded also. This webinar that we are talking about in the future will discuss climate change adaptation efforts put forth by the CDC grantees in Oregon and Vermont. And directly after, oh my gosh, a lot going on tomorrow. At CDC Emergency on Twitter, we'll host a Twitter chat at 2 p.m. Eastern tomorrow. So if you are watching this on the 15th, the 16th is also an exciting day. You can use hashtag CDCPrep to join that conversation. But remember, today's is APHA Get Ready. Okay, let's get the discussion going, shall we? I think the first thing we really need to talk about is what is climate change, and I'm going to throw this to Dr. Rudolph.
Okay, well, climate change is a result of the emissions of greenhouse gases that act as a heat-trapping blanket in the atmosphere. And those gases come from a variety of sources that really relate to our transportation system, our energy system, our food and agriculture system, the way we generate waste, and so on. And as a result of warming, we see global climate impacts such as sea level rise, warming in the average temperature of the ocean and the atmosphere, loss of snowpack and of glaciers globally, and because the oceans act as a sink for one of the primary greenhouse gases, which is carbon dioxide, we see acidification of the oceans. Those global climate impacts in turn have a lot of impacts on local environments, both socioeconomically and physically, that lead to a whole variety of health effects and also lead to a variety of extreme weather events that are really going to be the focus of today's conversation.
Okay, so that sounds like a pretty big emergency, I would say.
Climate change is, in fact, a health emergency, both in terms of its impact on extreme weather events that we all perceive as emergencies, but also because if we don't reduce our greenhouse gas emissions now, we will continue to see worse and worse climate chaos with very, very significant implications down the road for the health of humans around the globe.
Okay, well, I think then that dovetails a little bit into our next question, which is, what is emergency preparedness and response? Which I'm going to kick over to Dr. Beard this time, except, yes, that is what I'm going to do.
Okay, thank you. Yeah, I'll take a shot at that one. When I think of emergency preparedness and response, I'm really thinking of three components. The first is specific resources. So these are things, the items that you need for personal protection and for provisions. The second is capacity, and by capacity, what really we're talking about is having the critical information, understanding and know-how, to understand how to deal with the situation. And then thirdly is having a plan. And a plan is knowing where to go, what to do, and how to stay in touch, essentially. So if you think of this, you can think of this at a personal level, or you can think of it at kind of at a local, government level. And at a personal level, it might be something like just having an individual preparedness for forest fire. Living here in Colorado, in Fort Collins, where our division is located, we've had a number of forest fires quite nearby, and so we got accustomed to having a lot of the things that we need in a box that we could just put in our car and leave if we had to, if we had short notice like that. Personal information that you have, contact information, all the critical paperwork, things like this, things that you just couldn't live without. And at a kind of more of a governmental level, when we think about preparedness, there are things like being prepared for natural disaster, tabletop exercises where you would actually stand up a local incident command system with emergency operations center, and you actually practice these things before they really happen, so you know what to do. And again, but it's resources, capacity, and planning.
Excellent, and I think you gave some really good examples of what I think Matt might talk about next, which is what is climate change preparedness. So Matt, why don't you take it away for a little while?
Well, from a public health perspective, climate change preparedness is really understanding the climate change is occurring in your region. It varies across the whole United States. We're a large country. I think for the Northeast, we're looking at a region that's getting warmer, it's getting wetter, and it's getting more severe weather events. It's very different from California, which is getting warmer, getting drier. They have their own severe weather events, which we'll talk about when it gets to wildfires and such. So from a public health preparedness perspective, for me in New Hampshire, it's really about getting resources out to the local communities. We're trying to basically do workforce capacity development right now with our local health departments. And we need them. They've already done a very good job of doing emergency preparedness. We just need to kind of work with them and understand what are the short-term weather events that are occurring now that you can deal with and that are important. What are the vulnerable populations being exposed? And then and kind of follow up to that. How's your region changing? Do you expect to have more flooding in your area? And is that going to be affecting people in certain parts of the towns you're in? And do you expect to have more heat waves? So we're working with some of our local universities to develop estimates of what are the number of days that are going to be over 90 or 95 degrees? What are the number of precipitation events that will be more than 2 or 4 inches in 48 hours? They can understand that. They can begin seeing where they are now and where they are expected to go. And they can begin developing training and response capabilities and equipment resources around those that can help them feel more prepared for it.
All right, these are all really good, I think, examples of emergency preparedness and climate change preparedness. But Linda, you had something to say about the difference between preparedness and resilience. Is that correct?
Yeah, I think preparedness is obviously critically important both at an individual and a community level, and a big important role for local health departments all over the country. But I think another thing that local health departments can really help communities do is to build climate resilience. So we know, for example, that people are differentially impacted by these climate events, that people that don't have good transportation might have a harder time evacuating in case of a flood. And we certainly saw that in Hurricane Katrina and Superstorm Sandy. We know that people that have pre-existing cardiovascular or respiratory disease are at higher risk of impacts of wildfire smoke. So the more that, we also know that having socially coherent communities really helps people respond both during and after these extreme weather events. So the more that we can do to improve the health of our communities, reduce other sources of pollution that contribute to respiratory and cardiovascular disease, build social cohesion, and ensure that people have access to the resources that they need to respond appropriately, the more resilient our communities will be in the face of some of these climate-related extreme weather events that are going to be increasing regardless of what else we do.
Yes, super good points. And as we are looking forward and talking about weather events that are increasing, one thing we have seen this summer is this very long wildfire season, which has caused ill health effects, loss of homes, and there's a strain on the U.S. Forest Service. So, Linda, I think you and I are just going to keep on talking for a little while here. What is different about this year that makes it stand out from past years with regard to wildfires? Oh, Linda, you might be muted right now.
Am I unmuted now? Yes. So I can speak most to what's happening in California, but I think it's reflective of what's going on all over the western United States, and that is that we have had a severe drought in California. I saw estimates just recently that the snowpack in California is the lowest that it's been in probably about 500 years. And as a result of this drought, we have a very severe drying out of vegetation all across our forested areas. And some of the forests are also impacted by an increase in disease brought about both by drought and other climate-related changes in the pest population. So we have tinder dry brush and wood all over the West. And we also have had a very hot summer. And these two things combine into creating these explosive wildfires that started earlier in the season and persist later in the season than typical. They're very unpredictable. In California, we're seeing hundreds of thousands of acres burned. We've got 3 fires going right now that are all very large that have burned up about 700 homes already. That was the latest count, but it's increasing rapidly as we speak because these fires are difficult to contain and that are creating extremely hazardous smoke conditions for hundreds of miles from the scene of the fire. We know that these plumes from wildfire smoke can actually carry very, very long distances. And with the wildfire smoke plumes come significantly increased exposures to high levels of particulate matter that have significant health impacts.
What are some of those health impacts? Like, just if I'm breathing smoke, I know I feel bad, but what does it mean for my health?
Yeah, well, the key, wildfire smoke has a whole variety of components in it, but the one that's the most concern for us in terms of the health impacts is from particulate matter. And on an acute basis, the effects of smoke include eye and respiratory tract irritation, but also may cause reduced lung function or bronchitis or exacerbation of asthma or premature death. And we know that exposure, particularly to fine particulate matter, is linked with increased mortality and aggravation of pre-existing respiratory or cardiovascular disease. So we see even in healthy individuals that high levels of exposure to particulate matter may cause coughing, wheezing, and difficulty breathing, and that in people with pre-existing respiratory disease, we may see asthma attacks or really serious breathing problems. And in people with cardiovascular disease, high levels of exposure to smoke may actually cause angina or exacerbation of congestive heart failure or heart attacks. The elderly are particularly at risk, in part because many more of them have pre-existing lung and heart disease. And children, even healthy children, are also a sensitive population because their lungs are still developing, so they're more susceptible to air pollution than healthy adults are.
And you and I were talking a little bit before the Hangout started, but you have had some direct interaction, some direct effects of breathing some of that smoke. Is that correct?
Yeah, I just got back from a wonderful vacation backpacking in the Sierras, but the first 3 days we really experienced very heavy smoke. So it affected us both in terms of giving me a bad cough, and I apologize, I'll probably cough my way through part of this discussion, but also it really very severely reduced visibility. But that is a reminder that changes in visibility are one good way to actually estimate the magnitude of the health risk that is associated with smokiness. And I mentioned that these smoke plumes carry a long distance. So now, people in Fresno and people in Sacramento, they're all getting ash all over their car and having this haze in the air that reduces visibility. But, we know that if you can see about 10 or 11 miles, you have good air quality. But once you get down to not being able to see, a mile and a half away, you're really getting to the level that is unhealthy. And on our hike, we were in an area where we couldn't see the mountains surrounding us. And when visibility is less than a mile, that means you're in a hazardous air quality area in terms of the level of particulate matter. And the best thing to do is what we did, which is to get out of that area. We can talk more as we go about what else people can do to minimize their risk from wildfire smoke.
Sure, and it sounds like you weren't, like right next to a wildfire. It was a little way away from you, correct?
Yeah, we were probably 50 or 60 miles away from the closest wildfire.
Okay, so it seems like even if the wildfire is not, right next door, it has an effect, and so people should be concerned. There's cause for concern and cause for taking action.
Yes, in fact, I think Ben mentioned just before the Hangout opened up that they're experiencing smoke in the air in Fort Collins from the California wildfires, and that's probably 1,000 miles away.
That is just so wild to me. I don't mean to make a play on wildfire there, but it is wild. It's almost unbelievable, but it's the truth of what we live right now. So what can Americans do to prepare themselves for the health effects of wildfires besides get the heck out? Because even getting far away is not enough, right?
Yeah. Well, first of all, I think the one important thing is to understand what to do to reduce smoke exposure if you are in an area where there's smoke. And the first thing is to stay indoors and to not do a lot of heavy exercise when you are experiencing wildfire smoke. But staying indoors with the door and windows closed can usually reduce exposure to the wildfire smoke fairly significantly. And if people can turn on air conditioning that in a way that recirculates indoor air, that does even a better level of reducing the exposure to smoke. Of course, one of the drawbacks of doing that is that if it's very, very hot outdoors and people don't have air conditioning, you increase the risk of heat stress. So these different things, these different climate-related events interact with each other. Just like drought exacerbates the risk of wildfire smoke, we don't want to reduce smoke exposure and cause heat stress at the same time. Of course, it's really important not to create other sources of indoor air pollution like smoking. You don't want to smoke indoors when, in any case, but especially during a wildfire. It's possible to use room air filters that filter out some of the smoke, or room air cleaners, but I should mention that probably it is not a good idea to use ozone generators because that might actually increase the adverse effects from the smoke, because ozone, even at relatively low levels, can irritate the airways. In places that often experience wildfire smoke events, it's good for people to create a clean room in their house, a place where they have a room air cleaner set up, and they know how to run the air conditioning properly so that they're not bringing in more smoke, and that they have appropriate supplies of food and medication, as Ben mentioned earlier, so that they're able to go for several days without having to go out into a really smoky area. For people that have pre-existing cardiovascular or respiratory disease, they should really check with their physician in advance of a wildfire to understand what they should do and how important it might be for them to actually look at trying to relocate when the smoke is, before the smoke is really, really bad, so that they're not at increased risk. And then real respirators, not paper face masks, but respirators like N95 particulate respirators, if they fit properly, can significantly reduce exposure to particulate matter, but it's hard for people to wear those for very long if they're fitting properly, and there's really not much in the way of properly fitting N95 respirators for children. So, I think in the long run we can try to reduce smoke exposure during an event, but there's not a lot that we can really do to completely mitigate the risks of wildfire smoke. And it just highlights again the importance of doing everything that we can to reduce the pre-existing risks of cardiovascular and respiratory disease in our communities, and to take really rigorous action to reduce the long-term impacts of climate change.
Absolutely. Now, I'm going to swing it around a little bit, and it'll feel like it's not related, but it is. Not just wildfires, but we have also seen flooding happen in different parts of the United States this summer, and many people, it seems, were surprised that there was a lot of flooding in Texas. So we are going to talk about how does flooding affect the public's health, and I'm going to kick it to Matt for this first question.
We've been learning a lot more about how flooding affects public health, and some of the recent studies that break down kind of who gets hurt, injured, or killed before, during, and after a flooding event, it provides some insights. It seems like before and during an event, it's mostly the younger men, 20s, 30s, 40s, who seem to get most of the impact, injuries, and deaths. And that's not surprising. They're often, working in jobs which are more dangerous. They're often the head of a household where they're the ones going to go out and do the work outside the home, whether that's battening it down or driving to and through to get supplies. So that makes sense in a way. And after a flood, it seems to be more the elderly, people of lower income, women and children, and a lot of those impacts are very different, right? After a flood, you're doing cleanup. After a flood, you're dealing with the social and economic and other impacts of having a damaged home and then dispersed family, if you're actually even able to be back in your home. And you're dealing with the effects of flooding if you've got damage in your house and you're looking at additional mold and other problems that are occurring in the house. So it kind of gives us a perspective of two different target audiences or target groups to look at before and after we impact it. I think probably the people who are doing some of the best work in this and have for decades are the Red Cross. I often turn to them and look at their website and their resources, and when actually events are occurring, working with them to make sure that we're on track, because public health departments don't deal with flooding necessarily a lot of the time. It often ends up being a very local issue.
Okay, so looking at that then, and looking at both the public health department aspect of it and then the individual aspect, when we're talking about preparedness for unexpected flooding, it sounds like we are preparing for both before/when the flood happens, and then preparing for the stuff we have to do after the flood. So what can Americans do in those two cases?
I'd say probably the top things, are having a plan, which is challenging. We've done, studies of preparedness in the country, and not a lot of people have a home plan for dealing with things. Having the resources available, so as Ben was talking about earlier, having a kit, having something in place where if you need to move quickly, gather things and go, something like that can happen. And then in kind of after a flood, It's really waiting for the right time to go back, making sure that authorities have cleared the way for you to get back in and deal with the flooding. And then when you get in, it's kind of working with what you can do yourself, but also working with professionals to try to identify the hazards that are in the home and then mitigate them out. After a flood, a lot of the problems can be hidden behind walls and other places where you wouldn't necessarily notice them. So you really need to get in, and doing a quick clean up and clean out and dry out is one of the most important things. Did that answer your question?
I think it did. I think it did.
Okay.
And then when we talked about having the plan and making a plan and making a list of all the stuff you need, you can find those resources on aphagetready.org and many other places, but that's the one we want you to go to. So, okay, so there are floods that have happened in the past. Like this year, flood season, it's not like this is the first flood ever. Why are we more concerned about floods now than we have been in the past?
I'd say because the frequency has become greater. They're probably less predictable in many ways. I talked earlier about the fact that we're having more events of 1 inch, 2 inch, and 4 inches within 48 hours, which is kind of one of those measures you have, because the longer you have a rain event or precipitation event, the more likely it is to get the ground saturated. Once the ground is saturated, there's not going to be anything being stored as it normally would be, and it's going to have to rise up to the surface, and it's going to begin turning roads and fields and towns into its own passageway to find its way through. Water will go in the path of least resistance. So I think that's one of the challenges. We're actually, at least in the Northeast, having more precipitation events here. There's something to be said, and this might be more of a California or Colorado thing. People are building in areas where they didn't used to. One thing is there's more building in floodplains because often that's the place where some of the major urban areas are. And as we know, most of our population is surrounded or is, kind of condensed in the coastal areas. That's where a lot of the economy happens, that's where a lot of exchange happens, a lot of universities. Basically, it's a lot of business. That's where people want to be. So if you have inland flooding, which is combined with coastal flooding, I think there's more people at risk now. There was a great kind of book that came out, kind of a pamphlet, I can't remember who did it, called Natural Disasters, Acts of God or Acts of Man. And the question there was, well, how much is it that we're having additional severe events? And back in the 80s when that was written, it wasn't that many. And how much is it that we're actually putting people in the way of extreme events in the floodplains in the coastal areas? And I think the strong case can be made that we have more people in more vulnerable areas, and that's a real challenge for public health officials, because we're not that involved in community planning, so we're kind of often dealing with the after effects of that.
Yes. Okay. Sorry for that delay there. Yeah. Things seem to be changing pretty quickly. Is what I'm understanding from what you're saying and just what I see. Linda, it sounds like you maybe have something else to add on to that.
Yeah, I just wanted to echo what Matt said about how important our land use planning is in terms of increasing the risk of exposure to some of these climate risks, because just as people are moving into floodplains, we also see a larger population living at the urban wildland interface, which means that they are living in areas that are at higher risk of wildfire. And in this instance, I'm talking not about exposure to wildfire smoke, but exposure to displacement from having their homes burned. And of course, the more people and structures that have to be protected, the more at risk our firefighters are. And it's really firefighters that are at the most risk of injury and death in these wildfires as they do their heroic work trying to preserve homes and structures, particularly at this interface.
Yes, great point that there is that interface of both the public health professionals and the people who are working, who are not necessarily public health people, but working to benefit the public's health also. Good point. These are all great. I feel like we're covering a lot of really good topics. And we're going to just keep on doing that. So the next thing we've got are changes in climate conditions, such as a shorter and milder winter. Although if you see me in February, I will probably disagree with you on a day-to-day basis, but overall, yes. And then earlier spring seasons and hotter summers, which I will also agree with, create a more welcoming environment for ticks and insects, which is not great. Those may increase the risk of vector-borne diseases. So Dr. Beard, this is our time now. Can you tell us what it means when we say vector-borne diseases, and how does it affect my health, your health, everybody's health?
Yeah, so vector-borne diseases are diseases that are transmitted to humans through carriers, which is what we mean by vector. And these typically are such things as mosquitoes or ticks. And then these vector-borne diseases are usually harbored in wild animals. And it's very important. I'll come back to that maybe a little bit later if we get there. But each year in the U.S., there are tens of thousands of cases of tick and mosquito-borne illnesses reported to CDC. And these diseases can sometimes be very serious, even life-threatening. And they include such things as West Nile virus infection, Lyme disease, and plague and tularemia, both of which have been in the news a lot lately. And, you know, and then in terms of how we protect ourselves, which is a question a lot of people have, you know, one of the most important ways is by using insect repellents when you're in areas where you can be bitten by ticks or mosquitoes. And mosquitoes, these might be on your back porch in the evening especially, and for ticks, you know, if you live in a suburban area and you've got fringe around the edge of your yard perhaps, or green spaces in your neighborhood where deer may pass through or browse, or where the small rodents that are the reservoirs or hosts for the immature stage of the ticks frequently live. So for Lyme disease, we suggest that you wear repellents, you conduct tick checks after you've been in these areas, that you shower soon after you have been there, so you come indoors, and showering actually can be very protective for washing off ticks that might not be embedded yet. And then if you get an illness, especially a fever or rash, let your healthcare provider know, you know, if you've been bitten by a tick or if you've been in an area where you might have been exposed to ticks.
Okay, and I think you just sort of, this is a good question from possibly the internet, which is, how do you check for ticks? I mean, I have heard the country song, but that's, I think, a different thing.
Yeah, there's some very colorful explanations of this, but basically, you know, it's best to work with a family member, you know, your significant other, maybe, and certainly if you're a parent with your children, especially younger children, and you know, you just gotta kind of get down in the weeds, you know, and look in places, you know, cracks and crevices, you know, areas. Ticks, you're exposed to them, they crawl up your shoes typically, and your socks. And which gets into something I would suggest also. When I'm out in the field, I frequently spray my shoes and socks down with permethrin. Something is a common compound, and it works both as a repellent and as a toxicant. You can also use repellents with DEET in them, and there are a lot of other repellents as well that will work, but using these are very important deterrents. But for tick checks, you know, you take your clothes off typically before you shower, and then you look, you know, especially around the edges where your clothing clings to your skin, you know, at the tops of your socks, around your underwear, look at your base of your scalp, you know, at the hairline, and then look in those cracks and crevices. And I think I'll stop with that.
Okay, but I'm going to keep going, though, because the next question is, what if I find a tick? How do I get it off of me?
Yeah, so removing ticks, actually, there's a lot good information. If you go to our website, we've got some great information there, and basically, you want to use some very fine fine forceps, and you know, I I probably have some here in my office, and I could have, if I'd known this question was coming, I might have been able to demonstrate it. But you want to put those forceps really close to the skin, as close as possible, right down on the edge of the tick's mouth parts. And so you've got them really close to right where the tick is attached. And then you want to pull really gradually and smoothly. You don't want to jerk it. You just want to pull, straight up. You don't twist. No need to use an ice pick. No need to use a match, anything like that. It's just pull really gently and forcefully, gradually. And what that will do, that will slowly pull the tick's mouth parts out of the skin. If you jerk it or pull it really hard and fast, then sometimes the mouth parts will actually break off in the skin, and then that can result in infection. And so you want to remove those, and then you can save the tick in a plastic bag, a Ziploc bag, and in some places, local health authorities and local universities will test the tick. But if you live in an area where Lyme disease is common, then there's not a whole lot of value to testing the tick to see whether it's positive or not. And basically, you should be aware of the fact that if you have a tick bite and you develop any kind of symptoms after that, you really should report it to your physician or healthcare provider.
Very important. And I have a tiny little follow-up, which is, we're talking about forceps, but I have tweezers at my house. Would that do?
Yes, I'm sorry. As a scientist, I say forceps. Forceps and tweezers are synonymous. Maybe like a violin and a fiddle or something.
That's okay. That's why you are the doctor, and I have a bachelor's in journalism. So,
thank you.
I think we talked a little bit about at the beginning how the changes in climate are making it more hospitable for these vector-borne diseases. What is the link between climate change and these diseases, their increase, their rise?
Yeah, good question. I often like to think about this through what I call a One Health lens or perspective, which embraces the concept that disease emergence occurs at this interface between humans, animals, and the environment. And so climate affects the distribution and abundance, both of the pathogens, the vectors, and also the animal hosts that carry them. And so there's a strong ecological link between the vectors, the diseases, and the hosts. And then climatic variables, such as temperature and rainfall, these can affect disease transmission by impacting the replication of the pathogen. Warmer temperatures, mosquitoes with West Nile, the virus is going to replicate at a faster rate. Mosquitoes go through their life cycle more quickly at warmer temperatures, and so all these things are sort of working together. And then climatic perturbations, such things as storms, severe storms, droughts, weather patterns, ENSO, like the El Nino year that we're in right now. All these things can have an effect on driving disease outbreaks that we see of vector-borne diseases.
Yes, and I think Linda might have a follow-up for you on that. Dr. Rudolph, do you have a question for Dr. Beard?
I think you're muted.
Okay, is that better? Sorry. When we were in the Sierras, not only did we encounter smoke, but we also came across lots of signs on all of the bear boxes from the rangers saying, caution, plague has been identified in this area. And I'm just wondering if plague is one of the vector-borne diseases that you would expect to be impacted by climate change.
Yeah, that's a really good question, and we actually have seen a higher number of plague cases this year. We've had a number of cases here in Colorado, and you probably heard in the news about the cases in California and Yosemite, and we've been following that very closely and working with the National Park Service and the California Department of Health on those cases. And what typically happens, a lot of times we think of plague as something we call a trophic cascade cycle, and this is the whole idea of the way weather, mild weather, rainy weather, and in the fall gives rise to growth of grasses and things like that, and milder winters and earlier wetter springs, and those things can contribute to blooms of rodents, larger populations of rodents that are the reservoir host for plague. And then also fleas live off host for part of their life cycle, the fleas that transmit plague. And those do well in these warmer, moister conditions. They survive better. And so typically when we have El Nino type patterns, we often think of that as being an increased risk for plague, hantavirus, tularemia, some of these other zoonoses that we're seeing right now. And then if you get a really hot, dry weather pattern that comes through, often that can shut down a plague epizootic or an outbreak in animals that we see, just because it really kind of bakes the ground, and the fleas don't do well when it's really hot and dry like that. But the moisture weather really kind of encourages these expansions of rodents that are the reservoir hosts for fleas. And for plague prevention, I should also say, if you're concerned about that, wearing repellent, again, is useful. Avoiding carcasses of dead animals that you see, reporting those to the Park Service if you're camping, or to your local health department, and then just avoiding exposure to fleas, which means don't handle these animals. In some cases, dogs, or cats bring in these dead or dying animals, and the fleas can jump from those animals to the pet, and then they can jump from the pet to you and bite you. And so one of the studies we did a few years ago, it actually showed an increased risk of plague from sleeping with your dog. And this was just a case control study of a number of cases that occurred, and one of the risk factors was allowing your dog to sleep on your bed. And because for clear reasons, if the fleas were on the dogs and they jumped off them and bit you. So the things like that you can do. And most importantly, though, is if you get sick and you've been in one of these areas camping where those signs were posted, be sure to tell your physician, because they might not expect something like plague, because it's not very common. But if you tell them about your travel history, that's hugely important. That will help them connect the dots. And that can make the difference in life and death with a disease where if it's very easily treated, but if you miss it, it's very highly fatal.
I know I, for one, was not expecting plague in this Google Hangout, but here we are. But this is really good. I think that should maybe that should be our. I'm looking at the people in the room here at APHA. Maybe that should be our next Get Ready fact sheet. Get ready for plague, just in case. We're about preparedness here. But there's a difference between preparedness and resilience. And I want to talk to you guys a little bit more about climate preparedness versus climate resilience. How is it that we can prepare for disaster, but also build infrastructure so that we are both ready just in case and ready when it happens? Does that make sense? I hope it does. But this is for everybody.
I might take a shot at that first. I'm not on screen, so I'm not sure if I'm directed towards me. But the way we're looking at, trying to evaluate resilience and vulnerability seems to be a little more straightforward to measure. We're able to look at census data and coverage for healthcare issues, for healthcare insurance, things like that, and get pretty good senses through what they call social vulnerability indexes of, who are the most vulnerable people, especially to weather events in our communities. But measuring resilience is a lot harder. Resilience seems to be a combination of those social vulnerabilities, or that social kind of protective factor, how affluent you are. Resilience seems to be related to your social capital that you have in your community, your level of volunteerism and the cohesiveness, the number of organizations you have, civic organizations. Resilience seems to relate to kind of the planning and resources that are available at your kind of local and governmental level especially. And I think San Francisco is kind of ahead of the curve on measuring resilience at the community level, getting out. But I think it takes surveys, and it takes some more kind of labor-intensive efforts to decide what they are. So we're still struggling in New Hampshire to come up with what are good measures of resilience that we could apply and actually, invest resources and see differences over time.
That's interesting. Can I follow up with you on that? So if I'm following that correctly, like the neighborhoods, the communities that have greater resources are the ones that are going to be more resilient.
Right.
But then if I'm following correctly, then it would seem that the communities that are already more at risk, like those lower income communities that are already more at risk, are then going to be less resilient because they don't have those resources. Is that correct?
Yeah. You can imagine a lower income family, if they're hit by a severe weather event, their resilience is pretty thin, right? They're probably going to have just enough money to get through a next paycheck, to get through something else. They may be renters. They may have probably their social circle probably doesn't have a lot of resources. They might not have people who can loan them money or give them a place to be. So they have a lot of pieces of that web that can fall apart quickly when they go through some type of a weather or climate-related event.
That is incredibly frustrating as a public health advocate.
Yeah.
And people in the room here are nodding too. And I know that Dr. Rudolph was also on our chat here letting me know that she's got some stuff to add on to this. So I'm thinking that Dr. Rudolph, you are probably also a little frustrated with this too. Is that right? Oh, make sure you unmute yourself.
I think Matt raises a bunch of really good points, but I just wanted to add on that there's quite a bit that we know that we can do that will create resilience in the face of some kinds of climate events, both in the social and the built environment. So I mentioned already the importance of really addressing health inequities and doing whatever we can do to reduce all of the other factors that are contributing to increased rates of cardiovascular and respiratory disease in some neighborhoods. And also building social capital and building economic capital. So that's something we really need to pay attention to, that by reducing health and economic inequities, we are actually really contributing to building climate resilience. But the other thing we can do is pay attention to what we know risks are, even without necessarily measuring resilience. So we aren't talking about extreme heat events on this Google, but there's a whole bunch of things that we know communities can do to increase heat resilience. We can plant more trees. We can, have cool roof programs like the city of Los Angeles does. And those have other ancillary health benefits and other ancillary economic benefits. We know that, we know strategies to reduce air pollution so that when there's a heat wave, we don't have even more ozone in the atmosphere. So I think we also need to sort of really, in each community, systematically think about what are our climate risks and what are our baseline health and health inequities risks, and how can we address them using strategies that we know can be effective, and ideally looking for the many, many opportunities for climate and health co-benefits.
Great points, Dr. Rudolph, and also great examples of places and communities that are doing things right, which I think is really good. We've got one more question for everybody, but I want to remind everybody watching at home about #APHA Get Ready if you have any questions. But in the meantime, this is my last question that I have written down for everybody, and that is, everything we've talked about today, from flooding to vector-borne diseases to wildfires, is happening right now. Can you provide examples of communities responding to these changes and how they protect their health? And we've talked a little bit, but I am ready for you guys to give me even more good news. Anybody can go first. I hear Matt laughing. Oh, wait, here comes Linda. Go ahead, Linda.
Okay. Well, I want to talk about the fact that, I also mentioned before that taking action to reduce our greenhouse gas emissions so that we reduce the magnitude of climate change over the long haul is really, I think, the single most important thing to do. Because although we can take actions to prepare for and build resilience in the face of these extreme climate events, unless we really take action to transform our systems, our transportation system, our energy system, our agriculture system, we will not be able to prepare and adapt enough for the severity of changes to come. So it's really incumbent on everyone in public health to be working for the Clean Power Plan and working to reduce our carbon dioxide emissions from our cars and trucks and do everything that we can to support robust climate solutions. And those will bring many health co-benefits like reduced air pollution and so on, which I won't go into further. But I think that's the most important thing we can do.
Very good. Dr. Beard, how about you?
I'll try to take a shot at that. I can't think of a lot of really. I'm sure there are some. I just don't know of a whole lot of really good examples of community-based efforts. There are a number of community in the world of vector-borne diseases relating to climate change. There are numbers of community practices. They're more at the state health department level that are engaged in these discussions right now, but the thing I would probably say about vector-borne diseases, taking Lyme disease as an example, the most important thing I feel that we can do as public health agency or as local enthusiasts can do for Lyme disease in 50 years as it relates to climate change is no different than what we should be doing right now. It's identifying and validating effective prevention and control practices. And I mean, this is really hugely important, increasing neighborhood awareness. And there are a lot of community Lyme disease groups that are interested in prevention, and I think that's hugely important. From a public health standpoint, I think we need to prepare to prevent, mitigate, and adapt to emerging infectious disease threats that are related to climate change. And for me, what that looks like is a continued investment in disease surveillance to track disease trends, continued efforts at developing and validating effective prevention control tools and methods, maintaining a strong multi-level public health system. So, and when I say multi-level, I mean at local, state, and federal governments, so that when diseases occur in new areas that are introduced because of climate change, they can be detected and reported and responded to quickly. And then finally, an investment in environmental data collection and climate and disease modeling efforts that will help us be better prepared for what we expect to see in the future under various climate scenarios. So I think all those things are really critically important for preparation now.
So it sounds like we need to go from the ground level up, so from individuals up to big organizations like CDC, but also have that trickle down from the information from the fine folks at CDC and other public health organizations down to individuals, which I like. So we're all in this together. We are almost out of time here, so I'm going to let Matt take it away if he's got something to say.
Sure. Just kind of two examples which are kind of interesting. We have two groups that have created climate adaptation work groups in New Hampshire, one in the Upper Valley, which is the Dartmouth area, one on the seacoast in New Hampshire around Portsmouth, and two very different histories. First one in the Upper Valley really happened because of Hurricane Irene. I'm trying to remember the exact year that came in, but it hit Vermont and that side of New Hampshire so hard. A lot of dedicated individuals came together from the Dartmouth community and local communities to say, what can we do? And what they really did is they said, let's do education and outreach. So they brought people together into public forums and really started teaching them about weather, flooding, disasters, and trying to get that information out there. And on the seacoast, it took a different approach, really focused on the leaders in the community and developing assessments of where they expect flooding to happen. There's a real kind of attachment, of course, of people to their coastal areas. So I think there, the history is really around being near universities, being near places of knowledge where they could do more investment or more assessments. And I think those are two regions that were really able to take off and do much better adaptation efforts.
Those are great examples, Matt. Thank you so much for sharing them. I think, everybody, we're out of time already, which is sad, but we've learned so much, I feel. This is really exciting. Remember that one of our great resources is aphagetready.org. Dr. Rudolph has also asked that I share a resource called Wildfire Smoke, a guide for public health officials, which looks very cool from the PDF. It had a long URL, so I shortened it. So it is http://bit.ly/1TM_YJL5. We will tweet it later.
Can we
If
Google
you have
that?
this on YouTube later, you just go ahead and pause it right here. Okay. I just want to say thank you to everybody who watched today and everybody who will watch later on. And thank you to all of the panelists. You three were really wonderful. And before we go, I'd like to just go down the line. I'm going to call your name, and you're just going to say where today's viewers can learn more about yourselves and or your organization. So I'm going to go with Dr. Rudolph first.
You can go to our website, which is Center for Climate Change and Health at the Public Health Institute, and I also encourage you to join the U.S. Climate and Health Alliance, which will also pop right up if you just Google that name.
Excellent. And then, Matt, how about you?
Sure. I think the U.S. Climate and Health Alliance is an excellent one to go with because they've been doing great advocacy work across the country. Second to that, I would say going to cdc.gov and searching for climate and health will give you a great entryway into all the discoveries that are occurring around climate and its health impacts and the vulnerabilities that are out there. And you can find the 18 funded agencies now and find out if your state is part of that.
Excellent. And Dr. Beard?
Yes, I was just going to say www.cdc.gov, and yes, there's at the top, if you look, there's a menu, and that's got diseases A through Z, and you can look up climate and health, as was just said. You can also look up Lyme disease, West Nile virus infection, West Nile virus, all those illnesses, and so those are all great places to look for prevention information. The climate and health page at CDC is really excellent resources.
Yes, it is better than Wikipedia to fall down a hole on the CDC website and just come out hours later going, I have learned so much, but what was I starting on? I love it. Again, thank you all for joining us. I want to say thank you to the hardworking team at APHA who put on this Google Hangout. Will you guys all go woo because you're in the room with me? All right. Thank you. For more information on Get Ready Day, you guys can visit APHA on www.aphagetready.org, and don't forget to register for the Climate Changes Health 2 CDC Brace Grantees Take Steps Toward Adaptation webinar. It is tomorrow at 1 p.m. Eastern. That's all from me. Thank you so much, everybody. We will see you next time.
Thank you.